Dr. Kyle with your weekly wellness minute here. Today we're going to be talking about headaches. And my first question, if you're watching this, is if you've ever had a headache or suffered from headaches, you know just how debilitating they can be, not only on your day-to-day life, but more importantly, your family, your friends, your kiddos, unable to get on the ground and play with them. And so what I want to talk about is, first and foremost, most people when they get a headache, they either ignore it, hope that it goes away, or they take something. And the first thing I always ask a patient is the reason why you're getting that headache is because of lack of the Tylenol or Advil in your system? And usually I get a chuckle, but the truth of the matter is that's usually what we run to. And unless we truly correct the cause of it, we won't truly be getting rid of those headaches for the long term and not have to be dealing with those. And so what I wanted to talk about is like what's actually happening. And the model of spine here, this would be the base of the skull, and that top bone in the neck is kind of a circular shaped bone, and it rotates from side to side. And most people, when they get their headaches, they get tension right across the base of the skull here. It wraps up and around to the front, and if this top bone is out of alignment, it's going to put on, and I know it's a distance, but you can see that blood vessel there, it puts pressure on that, and it causes a throbbing sensation. And not only that, but more importantly, when we're getting that headaches, it's actually affecting the brain's neurological way to function with the rest of the body, okay? And so that pressure is going to put right at the base of the skull and the brainstem. It's going to be affecting not only the brain and the communication of the body, but it's going to be affecting the overall quality of life of what you have going on. So what we want to do is we want to actually give you a couple simple things that you can do at home in order to, when you're getting those headaches, to get rid of them, or ultimately you need to learn to understand what's going on and how to correct them. All right, so I mentioned there's something simple that you can do at home. All I've done is, you can see here, I've just taped two tennis balls together. We call them a peanut in the office. All of our new patients get one of these as a part of their care because we can use it on a lot of different things, not only for headaches, but for other aches and pains in the spine, but in the neck. But how I want to show it today is for that pain that we get right across the base of the skull right here when we're getting those headaches. Easiest thing to do is just go ahead and lay flat on your back. Set this underneath so you can see how I have the peanut where it's straight up and down, and just putting your head back flat against it, tucking your chin. So imagine giving yourself a double chin, and you just roll your head from side to side on those muscles right at the base of the skull. And when you find a really tender spot, what you want to do is you want to hold that there for a good 15 seconds. Now if you're exhibiting a headache at the time, it may be pretty tender, so just be careful about the amount of pressure you put. But what you want to do is you want to do that in order to loosen those muscles, so that way it takes pressure off of that base of the skull, it takes pressure off that atlas, so that way ultimately it will give some relief up and through there. And if it's a chronic thing, doing it even when you don't have headaches to keep those muscles nice and loose up there will help to keep those headaches to go away. So tune in next week for our next weekly Wellness Minute.